Pregnancy and childbirth can be a complicated time in a woman's life, with over 700 women dying in the U.S. every year due to complications, according to the CDC. 23 ABC's Veronica Morley spoke to the CDC about how they're looking to educate expecting mothers and those around them through its new Hear Her campaign.
Every death is a tragedy, especially when it can be prevented.
It just permeates an entire community. And there are signs and signals that we need to be aware of. But most importantly, I think we need to make sure that we're letting women know that they know their bodies better than anyone else. So we have launched the Hear Her campaign.
He's the one who noticed his mom's face was swollen.
And this is a campaign that's focused on pregnant and postpartum women and an opportunity to involve not only these women, but those who are close to them.
It was only last year that right here in Bakersfield, a 23-year-old woman and her unborn son died following complications after being treated for swelling and high blood pressure. That woman, Demi Dominguez, was kept overnight and sent home with medication the next day. After returning for a follow-up and being sent home again, Dominguez began seizing and collapsed at home. She was rushed to the hospital, where she died after delivering her son, who died a few hours later.
If they have a concern, if there's something that they feel just isn't right, we need to listen and we need to help them not only understand what these signals are giving them, but we need to make sure that they're connected to the appropriate health providers who can help to save their life.
The CDC is saying that as many as 2/3 of pregnancy-related deaths could be prevented as long as you listen.
You know, in many of the stories that we've heard about women who have died, that many of them had expressed that they weren't being listened to. And we really want to have an opportunity to really elevate their voices, not only by talking with women who are pregnant or postpartum, but also talking with those who are close to her. But for example, having a severe headache that doesn't seem to go away, having trouble breathing, having chest pain, having swollen legs or arms, those are significant signs that need further investigation.
And these red flags not only apply to expecting mothers, but postpartum women as well. Because while a newborn baby needs a lot of attention and care, a new mother can experience pregnancy complications for up to a year after giving birth.
Sometimes being more persistent is a way to make sure that they're being heard, but also involving the voices of those who are around them is really important too.
Veronica Morley, 23 ABC, connecting you.
And you can visit our website, turnto23.com, for a link to the CDC's Hear Her campaign. There you can also hear testimonials and find resources, including a guide for expecting mothers, to help start that conversation.